Hey everyone, and welcome to The Explainer. Today we are diving deep into one of the most prescribed pills on the entire planet, Metformin. You've probably heard of it. Maybe you even take it yourself. But what's the real story behind this pill? How did it become such a mainstay, and what is it actually doing inside your body? Well, we're about to find out. So here's our game plan. We're going to start with why it's called the first defender against high blood sugar. Then we'll get into the cool science, its clever three-pronged attack. After that, it's all practical stuff. A user's guide, the safety info you absolutely need to know, and finally, we'll look at where this incredible pill might be headed next. So let's jump right in.
And really, this is the big question, isn't it? We're in an age of brand new, super expensive drugs. So why do doctors all over the world keep coming back to this pill that's been around for decades? You know, the answer is pretty fascinating. It's not just about what it does, but how it does it so simply and so effectively. Okay, so let's start at the beginning. Its role as the first defender. Think about it like this. Managing high blood sugar is like defending a castle. Before you call in the catapults and the heavy cavalry, you need a totally reliable, trustworthy guard at the main gate. And for doctors everywhere, Metformin is that guard.
So what is it exactly? Well, at its heart, Metformin is a simple pill you take by mouth. It belongs to a family of drugs called Biguanides, and its main job, the thing it's famous for, is being the absolute go-to, first-choice treatment for type 2 diabetes.
But its job description is way bigger than just one diagnosis. I mean, yeah, it's the champ for adults with type 2 diabetes, but doctors also use it strategically to stop prediabetes from becoming full-blown diabetes, especially in high-risk patients. It's even used off-label to help women with PCOS. It's a real workhorse in medicine, and it's even approved for kids as young as 10.
So how well does it work? To figure that out, doctors look at something called A1C. You can think of it like a 3-month average of your blood sugar levels. Now, on its own, Metformin can lower that A1C number by up to 1.5%. Now, I know 1.5% might not sound like a lot, but trust me, in the world of diabetes management, that is a huge, game-changing improvement.
Okay, so how does one little pill pull off such a big result? Well, it's not a one-trick pony. It actually launches this coordinated three-pronged attack on high blood sugar, hitting the problem from multiple angles all at once. Let's break down exactly how it works.
First, it goes right to the liver, which is basically your body's main sugar factory, and it tells the assembly line to just slow down production. Second, it works on your cells, kind of making them more sensitive to insulin, which helps them pull sugar out of your blood for energy. And third, it even works in your gut, reducing how much sugar you actually absorb from the food you eat. It's a total system approach, which is why it's so effective.
Okay, so that's the science. We know how it works in theory. But what about in real life? This next part is the user's guide, the practical, day-to-day stuff you need to know to get the best results and, just as important, avoid any bumps in the road. Now, Metformin usually comes in two flavors. You've got immediate release, or IR, which is the standard kind you take once or twice a day. Then there's extended release, or XR. This one's designed to dissolve really slowly, which is fantastic for reducing stomach side effects. And this is so important. You can never, ever crush or chew the extended release tablets. If you do, it breaks that time-release coating and you get the whole dose at once, which is not what you want.
If there's one golden rule for starting Metformin, this is it. Doctors almost always start you on a low dose and then gradually, over a few days or weeks, they'll increase it. This start low, go slow method gives your body time to get used to it, and it is the single best way to avoid those initial stomach issues.
So let's just lock in the four most important things to remember. Number 1, always take it with food. That really helps with stomach upset. 2, listen to your doctor and stick to that start low, go slow plan. 3, just know that the target dose for most people ends up being between 1,500 and 2,000 milligrams a day. And 4, I'm going to say it again, if you're on the XR version, swallow it whole. No exceptions.
All right, let's talk about something incredibly important, safety. Look, any medication that's effective is going to have potential side effects. The key is to have a really clear, no-nonsense understanding of what they are and what to look out for with Metformin.
So, the side effects really fall into 3 buckets. The most common, by far, are those stomach issues like nausea or diarrhea, especially when you're just starting out. Then there's something less common but important for long-term users, a potential drop in vitamin B12. And then you have this one called lactic acidosis, and as you can see on the chart, it is extremely rare. But it's serious, so we're absolutely going to talk about it.
Let's zoom in on that vitamin B12 issue for a second. See,
over a long time, metformin can sometimes mess with how your body absorbs B12 from food. That's why doctors will often check your levels with a blood test from time to time, especially if you've been on it for years or if you start having symptoms like nerve pain or anemia.
Okay, now for the big one, lactic acidosis. This is the most serious warning that comes with metformin. It's a condition where lactic acid builds up in your blood, and it can be dangerous. But I really want to stress the words on this slide. It is a very rare risk. It almost never happens to people unless they already have other major health issues going on, especially really poor kidney function.
And because it's serious, even if rare, you have to know the warning signs. If you're on metformin and you suddenly get hit with symptoms like extreme fatigue, muscle aches, you're short of breath, or you have bad stomach pain and vomiting, you stop taking the pill immediately and get emergency medical help. This is all about being informed, not being alarmed.
And this all leads us to the single most critical factor for using metformin safely, your kidney function. Your kidneys are what clear metformin out of your body, so doctors use a test called the eGFR to figure out the right dose. As you can see, if your kidney function is good, no problem. As it goes down, the dose has to be carefully adjusted or even stopped. And if it drops below a level of 30, it's an absolute do not use. This regular monitoring is the secret to using metformin safely for many, many years.
Now, after all that, you might think, okay, the story ends with blood sugar. But here's the thing. Metformin's impact is actually way broader, and its future might be even more exciting. We already know it's a powerhouse for preventing prediabetes and managing PCOS. But get this, researchers are now studying it for potential benefits in things like healthy aging and even some types of cancer. It's just a classic example of how one simple, affordable medication can have this massive and still growing impact on health.
Which kind of leaves us with this final thought to chew on. In a world that's always chasing the next big thing, the newest, shiniest discovery, what can this old, simple pill teach us? Maybe the biggest lesson from metformin is that sometimes the most powerful solutions are the ones that are simple, accessible, and just plain proven to work. Thanks so much for joining us on The Explainer.